Good afternoon, and thanks for joining today. You will hear from Governor Tim Walz, Commissioner Jan Malcolm, HSEM Director Joe Kelly, Commissioner Steve Grove, and new today, Minnesota Department of Veterans Affairs Commissioner Larry Herkey. As a reminder, we ask reporters limit themselves to one question each with an on-topic follow-up. And now I would like to turn it over to Governor Tim Walz.
Thanks, Teddy. Good afternoon, everyone, and good afternoon, Minnesota. We'll try and keep our rhythm where we're short on the front end and leave as much time for questions as possible. But I did want to note, as many of you know, I had the privilege of addressing Minnesotans in my second State of the State address. Very unusual, unlike last year of a full house at the Minnesota State Capitol. I was in the basement of my residence here. I also want to say thank you to all the folks who made that possible technologically, and especially to the press for their willingness to do a lot of extra work to make that happen. And as I promised last evening, one of the things is to communicate decisions, explain when we change course, and never stop fighting alongside Minnesotans. And one of the ways that we are best able to do that is in these daily briefings. So once again, to the members of the press, thank you for making transparency a hallmark of what we need to do, relaying on-the-ground observations and questions that allow us to see it through different perspectives, and then again be able to communicate directly with Minnesotans. Today I wanted to just mention a couple of things we're taking and making known. Starting today, Minnesota veterans who are impacted by COVID-19 can apply for financial assistance grants from the Minnesota Department of Veterans Affairs. Commissioner Herkey will be on later to be able to explain this in more detail, but this was great work done by the legislature partnership to get $6.2 million. So veterans who raised their hands, served our nation, and are now experiencing financial hardships from COVID-19 will be able to apply for these grants. So the commissioner will give some specifics on that here in just a little bit. I'd also like to announce today, led by Lieutenant Governor, Department of Human Rights, that we have launched a discrimination helpline. And this is a helpline for folks to address. It's unfortunate this is happening, but it still continues to happen. We're still getting way too many calls of xenophobia and racism, especially aimed at the Asian American community because of COVID-19. So I know that the vast majority out there are supporting their neighbors, doing what needs to be done. But this is a time for us to stand up and help our neighbors. We've got a very vibrant Asian community in Minnesota, one that has been here for an awful long time. And to be unfairly targeted during this time just adds unnecessary stress. So that number out there is 833-454-0148, and we'll be putting that online. And just a couple of executive orders today. We did Executive Order 2028, which authorizes out-of-state mental health providers to treat Minnesotan patients via telehealth. Many are receiving that care. It's a way that I worked quite some time ago when working with the VA and the delivery of mental health services. And as these cross state lines, this will make sure that folks are able to continue to get the care that they need. And Executive Order 2029 makes two amendments to the unemployment insurance issue. The First Amendment provides an administrative fix to streamline applications, and the second implements federal notification requirement to help Minnesotans qualify for the additional, the $600 on top of that. These two changes actually speed up and will add about 45,000 folks who will now be eligible, and it'll cut down the wait time by months. And again, very pleased with the work that's being done in a very taxed situation over at the UI folks at D, but they're doing a great job with it. Now I'll turn it over to Commissioner Malcolm for some of the updates around the health side of this. Commissioner?
Thank you, Governor. Good afternoon, everyone. I will be brief with the situation update, as I know you can find this data pretty easily online. But it is sobering to realize that globally, as of this morning, we had very close to 1.3 million cases of COVID around the world and over 70,000 deaths. In the United States, we're fast approaching 350,000 confirmed cases. We were at just under 340,000 this morning, 123,000 of those in the state of New York alone, and 67,500 in New York City alone. The United States is reporting over 9,600 deaths, over 3,000 of those in New York City alone. Here in Minnesota, we are now at a total of 986 confirmed cases confirmed via laboratory testing. That's an increase of 51 over yesterday on a testing volume of about 1,300 laboratory tests done yesterday. I'm sorry to say that we have confirmed one more COVID-19 death. We are now at 30 cumulatively. Our most recent neighbor lost was a 98-year-old Ramsey County resident who had been in an assisted living facility. As of today, 470 patients have been released from isolation. Currently, 115 patients in the hospital as of today, 57 of those in intensive care. In the future, we're going to want to dig deeper into breaking down not only the cases, but also the deaths by race and ethnicity, populations of color, American Indians, because as is so true of just about every health issue we know, the burden of COVID-19 does not fall evenly or equitably in all communities. So we've just got some pretty high-level data at this time, including, this is all self-reported race and ethnicity data, and a not trivial part of the pie is unknown, as people are declining to identify by race. But we want to keep our eye on these disaggregated data. What we know so far in terms of the breakdown of cases by race, 74% are white. Just under 20% are either unknown or some other categorization of race other than the major categories. 6% of the total cases are Black, 4% Asian or Pacific Islander, 1% American Indian or Alaska Native. And in terms of the deaths so far, 23 white, 1 Asian, 6 unknown at this time. I only point this out because, again, I think we want to keep an eye on being mindful of how the burden of illness is manifesting in specific communities, and that will be important to look more closely at as time goes on. I'd like to mention just a couple of things in addition. Just a further word on our posting of specific congregate care facilities, long-term care facilities. I'm hearing a lot of concern from those long-term care facilities about how people are interpreting the information that we are starting to share now about the cases in those facilities. I want to be really clear that having a facility on this list simply means they had a case, either in a resident or a staffer or another person who was on site at the time they were infected. It does not mean that the facility is deficient in any way or has done something wrong, any more than we would say there was something done wrong by a family with a household member that has a case. And I'm really concerned and disheartened to hear that some staff and facilities are feeling unfairly singled out and stigmatized by the release of this public data. And I really would urge all of us to be thoughtful and careful about how we're using this information and how we're interpreting it. These are our most vulnerable residents, and they're feeling the brunt of this virus in terms of the health risks, the isolation that it's meaning for them, more than just about any of the rest of us. And without the care and the support of the staff who are working with them, we're going to have an additional crisis on our hands. So I think it's just incumbent on all of us to understand that these facilities are working very hard to protect their residents and their staff. And we continue to work very closely with them to do everything possible to prevent the introduction and spread of the virus. However, with community transmission as it is, we should expect that many facilities will have cases, just as many work settings and families and households around the state have had and will have cases. So we know that the risk of COVID-19 is general and widespread across all of our communities, and why it is so very important that we practice social distancing and take those other protective measures in all areas of society. We need to be doing everything we can to protect the residents, employees at these facilities in particular. I'd like to also just comment on the growing public discussion about the wearing of masks among the general public. The federal government has issued some new guidance on this recently, but I'd like to just say a few additional points of clarification. We just want to keep reinforcing that people who are sick need to be staying home and isolating, not feeling like it's safe to go out into the community just because they're wearing a mask. So in no way does this guidance to begin wearing masks for source protection, in no way does that lessen the importance of the stay-at-home directives. Secondly, masks can help with preventing your germs from infecting others, especially in situations where you might be shedding the virus without symptoms. So your mask protects me, my mask protects you, but these are not masks that protect the wearer from acquiring the illness. So it's just important that people understand what the mask is for. And the fact that these masks are a secondary protection. The primary protective measures, as we keep stressing, remain frequent hand washing, covering coughs, and social distancing, even when the weather starts to get beautiful. It's going to be important to still be careful about social distancing. I hope I'm still speaking to you. That was interesting. So we want to also just make a point of saying that we, again, just to repeat that for the public who might want to begin wearing masks as a way of protecting others, it's so critical that you don't try to buy or wear surgical masks or N95 masks. These are critical supplies that are needed in our healthcare facilities to protect our healthcare workers and our long-term care workers and critical first responders. So please, if you are going to wear a mask, it would be great if you could just find cloth masks or look to make your own masks. We do have some specific information on how to do that on our website. Finally, I want to just thank all Minnesotans, as the governor has done, for everything that you are doing. We really collectively are doing a good job of staying home to help slow the spread of COVID-19. We're hearing some concerns, however, from hospitals across the state about situations in which people with other very urgent health concerns appear not to be calling 911 or coming into the emergency department right away. If you're having symptoms of a stroke or heart attack, and certainly we're hearing this across the nation, not just here in Minnesota. We understand that people might be leery and worried about exposure if they go into the healthcare system, exposure to COVID-19. We really want to make sure that Minnesotans are not delaying care for serious conditions. Please, if you are having any medical emergency, it's important to call 911, just as you always have. This could include severe bleeding that won't stop, breathing difficulties, including known asthma or allergies, anaphylaxis, sudden loss of consciousness, signs of a stroke or heart attack. Delaying or not seeking treatment for these kinds of things can indeed be life-threatening. It's just important to say, even with all of the activity happening right now in preparation for the expected surge of COVID-19, our healthcare system is standing ready, is prepared, is equipped to safely treat patients experiencing any medical emergencies. So thank you very much for your attention to those important public health messages for today. And with that, I'll turn it over to Director Joe Kelly.
Thank you, Commissioner, and hello again, Minnesota. The news of the governor sending a request through FEMA to the president asking for a major disaster declaration had been widely reported on over the weekend. And when approved, that declaration will provide assistance to the state in addition to what's already been available under the current national emergency. Specifically, it opens up some reimbursement opportunities for assistance to individuals and families, and we expect a response soon, and we'll let you know as soon as we hear back from the federal government. Our team is in very close contact with FEMA. They assigned a senior liaison officer to Minnesota, and we communicate with him daily, in fact, multiple times every day. And he's been very helpful on a number of important projects, including the use of the National Guard and a request that we're currently working on to get approval of our medical sheltering plan. My key contact at FEMA is the regional administrator in Chicago. The country has 10 FEMA regions, and we're part of a 6-state upper Midwest region. The regional administrator previously served as a state director within the Midwest, so I know him very well, which makes communications and coordination much easier and much more efficient. So like most things in life, relationships do matter, and we have a good one with FEMA within our region. FEMA has always been a key partner in disaster response and recovery, and I know firsthand sometimes they have a reputation of being overly bureaucratic and confusing. at times to work with. But I think it's important for us to remember that that agency has provided hundreds of millions of dollars over the years to help Minnesota. And by that I mean our families, our cities, our counties, tribal governments, state agencies, and our non-private partners help make us financially strong after an incident. So I'm confident they'll be there for us again. To this point, they've committed to providing 75% reimbursement of our eligible expenses that are related directly to COVID-19 response. Some programs have higher reimbursement rates, and I think it's important for Minnesotans to understand that federal assistance is not limited to a dollar amount, but will be determined most importantly by the eligibility of the costs. I want to thank the state's GIS and information technology experts for helping support the public website for COVID-19 the governor rolled out last week. They can do techie things I don't even understand, but my agency's contribution was to build and maintain the data behind the Minnesota COVID-19 dashboard. That's the button on the left side of the page about halfway down. And since that website was turned on, Minnesotans have clicked on it more than 350,000 times on that one button. That tells me there's value to the information that's behind there for Minnesotans, and I thank our team for making it available to you. At this point, I'll turn the mic over to Commissioner Steve Grove with the Department of Employment and Economic Development. Commissioner?
Thank you, Director Kelly. Good afternoon, everybody. Wanted to share some updates on our state's unemployment insurance system, which has become such a central focus for us at the Department of Employment and Economic Development to help workers who are really struggling right now, separated from their jobs either temporarily or permanently, and stressed out and needing support. And so we've just focused all of our attention on making sure that program can meet the needs of Minnesotans. We have processed initial weekly payment requests for more than 90% of new or reactivated applications since March 16th. Yet the numbers continue to climb, as you'd expect. We are now at 120,000 more applicants for unemployment insurance in the last 3 weeks than we had in all of 2019. So it is a pretty unprecedented volume. And just to give you the latest statistics, as of last night, we've now taken in 342,043 unemployment insurance applications since March 16th. Last Friday, we had 18,342. And yesterday, Sundays, we are open for limited applications. We saw another 3,939. So the numbers do keep rising, and this week we really want to double down on our commitment to customer service so that we can get people what they need and get the money that they deserve into their bank accounts as soon as possible. So as the governor mentioned, we're, first of all, taking steps just to streamline our process. And there's a really common eligibility issue in our state's unemployment insurance program that the executive order the governor released today, 2029, sets out to take care of. So with this executive order, we are no longer required to delay benefits for people who are taking vacation, sick pay, or personal time off when they apply for unemployment insurance. And this is going to be so critical. We've got about 45,000 qualified workers who are just stuck in our application queue right now because they've applied. They're eligible, save for the fact that they have a vacation or sick pay issue in play. And so by clearing those up, we're going to issue payments to 45,000 people who are stuck in our queue right now far faster than we could have before. It's a really critical move for the governor to have made, and several other states have done similar executive orders along the same line. The second piece of Executive Order 2029 allows us to prepare to be able to issue the additional $600 per week of benefits that the federal government passed through the CARES Act. It's a simple procedural thing, but essentially we have to require businesses in our state to inform workers of the existence of unemployment insurance. And if we have done that, which the executive order does, we are then eligible to issue those payments. I will just say that that doesn't mean that starting tomorrow we'll be issuing those payments. We are still waiting on guidance from the federal government on drawing down that funding from the Department of Labor into our system. But we are in conversations daily with them, and as soon as they provide us that guidance, and thanks to this executive order from the governor today, we will be set to issue those payments. So we're moving as quickly as we can on that, and as soon as we get further guidance from the feds, we'll be set to go. So that's the big thing that we're doing today to streamline applications. The second thing that we're doing, and it's related to the first, is that we're reopening up our information line. And The reason it's related to the first is that our information lines have been pretty packed with these workers who are dialing in, these 45,000 workers who are dialing in to try to figure out why they're stuck in the application queue. By clearing some of that out, we hope to open up more time for our call center to help workers who need assistance with their application. So we do have our info line open again today. Similar to how we're tranching things out for the Social Security number schedule for applying for unemployment insurance benefits, we're also going to designate certain days and certain questions can be answered on our information lines too. So if you have a question about your account itself, you can call between Monday and Thursday between 8 a.m. and 2 p.m. If you have need help with your application, you can call on Friday between 8 a.m. and 4:30 p.m. And if you have an issue with your password, you can call anytime during normal business hours. Those password issues are some of the trickiest, and we want to be available at all times for people with those issues. Call time's still going to be long. You're still going to be waiting on the phone for longer than you would like, but we're hoping that this will speed that up a little bit. And as always, there's just a ton of information on uimn.org. It's always the best place to start. We update those FAQs daily, and we really ask people to start there. And if your friend or your family has a problem, start there with them and help guide them through the process online. And then lastly, again, just in this effort to really provide the best customer service we can to Minnesotans in this time of struggle, we are adding additional resources to the UI program as well. We've now translated all of our federal and local guidance into Hmong, Somali, and Spanish, and there are other translatable resources there as well using small and then applications. All of that is linked to on our website at uimn.org. So the team itself continues to expand our hours too. We're putting in lots of hours of overtime. We got 50 new staff helping manage calls, and a big area of focus for us now is how do we implement these provisions of the CARES Act, this new federal guidance that we've gotten. And we are on pace on all the technical aspects of that in terms of getting our platform ready. We really are just waiting for the guidance pieces from the federal government to be able to kick those additional benefits into gear. One of them that a lot of people ask about, and I want to address it here because it comes up so often and for good reason, is this additional benefits for independent contractors and self-employed individuals who may be eligible for aid under the Pandemic Unemployment Insurance Act. This is a great step the federal government has taken. If you are a self-employed individual or an independent contractor, please apply now for unemployment insurance. Getting your account into the system, getting your name on our docket, even though you'll be issued a denial now, means you'll be ready to go as soon as we get that additional guidance so we can issue you a payment as soon as the federal government gives us the go-ahead and gives us the clarity on how to issue those payments. So if you're a self-employed, if you're an independent contractor, no time like the present to apply now. Don't be dismayed by the denial letter you get because that's the natural way UI works today. But getting yourself in the system means that you'll be ready to go as soon as that federal guidance comes. And if you've already applied and you've been denied, you don't have to do anything new. We will proactively reach out to you once that federal guidance lands. So lots of updates on UI today, but wanted to share those things because for so many Minnesotans, this is just such a critical platform or critical source of income. Last, just wanted to continue to thank the Minnesota business community who is doing amazing things on a daily basis to help our efforts to fight COVID. The latest story we heard was from a pair of, or actually 3 different distilleries in the Twin Cities metro area, Tattersall Distilling, Denord Craft Spirits, and Brother Justice Whiskey, who have stopped producing spirits and start producing hand sanitizer. They produced 35,000 gallons of hand sanitizer this month by rejiggering their production lines. And they've launched a campaign on allhandsmn.org where you can go in and apply to get that hand sanitizer. Most of the time it's going to be free, and just a great way to use their expertise in production to provide a critical supply chain item for our COVID-19 efforts. And so we thank those distilleries for their hard work. With that, I'm going to turn it over to my colleague, Commissioner Larry Herkey at the Minnesota Department of Veterans Affairs. Larry.
Thank you, Commissioner Grove, and good afternoon to veterans in Minnesota. I think many of you know that Minnesota is always taking care of its veterans, and we continue to do so during this challenging time. As the Commissioner of the Minnesota Department of Veterans Affairs, I want you to know that we're open for business and we're ready to help and assist you, and that my staff is available to support our veterans and their families. Virtually, we continue to process applications for support through the State Assistance Program and the Minnesota GI Bill and the SOAR program. And in person, we are caring for veterans in the 5 Minnesota veterans homes. We're assisting at our 3 state veteran cemeteries, and we're working priorities such as ending veterans homelessness. For the grants program the governor talked about earlier, we want to say thank you both to the governor and legislature for providing $6.2 million in support to Minnesota veterans in the recently enacted COVID-19 response package. These funds will be available to eligible veterans and their families and who have been financially impacted by COVID-19. We are accepting applications for both disaster relief grants for $1,000 and also special needs grants up to $3,000, and that starts today. Applicants must be a veteran or surviving spouse of a deceased veteran as defined by Minnesota statute, a Minnesota resident, and have been negatively financially impacted by COVID-19. It's very easy to apply. In order to get the disaster relief grant, you just have to go to our website at Minnesota Veteran, that's one word, .org/COVID relief. And to apply for a special needs grant, the veteran should call their county veteran service officer who have been trained how to submit special needs grants on their behalf. I know that many veterans are proud and may be hesitant to ask for help, but I encourage you to apply for this financial assistance if you need it. We are here to help. And finally, a reminder to veterans that if you're feeling ill, please call your local VA healthcare system first before going in person. The phone numbers for the 4 VA healthcare systems are listed on our website again at minnesotaveteran.org. The VA medical centers will then provide direction on what you should do next. And with that, I want to hand it back to Governor Walz.
Thanks, Commissioner Herke and all of the commissioners. And with that, operator will be glad to take questions.
Thank you. And as a reminder, to ask a question, you will need to press *1 on your telephone. And to withdraw your question, you can press the pound or the hash key. Again, to ask a question, press *1. Please stand by while we compile the Q&A roster. Your first question comes from the line of Esme Murphy from WCCO-TV. Your line is now open.
Governor and Commissioners, thank you so much for continuing to hold these news conferences and taking this question. Commissioner Myron Frand suggested in a state Senate budget hearing today that our $1.5 billion surplus has basically evaporated. And Dr. Kalamidas said that Minnesota could be hampered in our recovery because by law we can't use deficit spending for a state stimulus package. How rough a shape is the state going to be coming out of this? And is one solution what Senator Gazelka suggested today at that hearing, allowing some businesses, he suggested especially ones that are linked to the outdoors, to get back to work?
Well, first of all, I'm glad that the state went into this in solid financial shape. It's what I've been preaching for a long time, that those rainy day funds needed to be there. I'm proud that states don't run deficits, but that's what the federal government needs to be a good partner in, and there's absolutely no doubt the CARES Act and others are meant to backfill on that. I think it's important now people are understanding the projections for the coming year are what the surplus was based on revenues as they were coming in and our best the best economic numbers behind that. That money was never in the bank. It was never there. It was going out in the future over these months, and it would have continued to go up. So it's not going to be there, obviously, and it wasn't there. The good news is we were in solid financial shape. We're able to pay our bills, but we will certainly have to balance the budget when we come out of this. There will certainly be lack of revenues because of the COVID-19 shutdown, and we want to get back to business as quickly as possible. I want to be very clear. If I thought it were healthy and I didn't think this thing would spread, we would open up every business tomorrow. So it's not the idea that we like these things being closed and the idea of using the science and to go through this. We are right now assessing sector by sector, line by line, as we look at an extension on the stay-at-home order, and how can we make sure that we're not putting people at risk, both keeping essential services open and distancing people. So I'm in absolute agreement of that. We need to get people working as fast as we possibly can, but the virus dictates this. The science and the health professionals dictate the time, and we need to be creative about it. It's why I keep pushing what the bridge looks like on this, why it's not there yet, but it is hopeful on antibody testing and rapid result testing that can get us back. So we're going to have a challenge when we come out of this. We've been there before. The state was in solid financial shape with rainy day funds. The The COVID responses like the CARE Act, the three that have come so far, will be helpful, but more is going to have to be done. But we'll get there when we get done. We'll get these businesses open back up. And as I said last night, this is going to be digging out after a long winter, and it's going to take a while. We've done it before. We had a $6 billion deficit back in 2010, and that was able to be turned around with growth in the state. So we're committed to it. It's bipartisan-wise. I am committed to getting the state as soon as we possibly can without putting a risk at all of the progress that we've made. In infection rates, Minnesota has 17 per 100,000 right now, which puts us best in the country, but we're not resting on those laurels. We're preparing for what will come, a surge to our hospitals, a burden on those emergency rooms, and the risk to our neighbors. But at this point in time, we'll reassess that. We'll continue in real time to do that, get folks back as quickly as possible, and thinking towards budget future.
Sir, did you say that the infection rate, 17 per 100,000, is the lowest in the country?
It is. They put out the data from CDC today, and I don't want people to get complacent about that. And there's also, I'm sure Jan would be the first to tell you, Commissioner Malcolm would be the first to tell you, we're testing at a pretty high rate compared to other states, but it still doesn't give us a true picture. So it's still, we have been blinded by the lack of testing and blinded by the lack of data to a certain degree. But in terms of looking at the rest of the country, we're starting to get a pretty good picture in that.
Thank you, sir.
Next question comes from Ricardo Lopez of Minnesota Reformer. Your line is now open.
Hi. Yes, my question is a little bit, I just want to get a little bit more detail or what we are seeing in the racial demographic breakdown around COVID-19 infections. Just based on what's currently reported now in terms of racial demographics, what trends are we seeing, and are health officials here concerned at anything that might look like disparities in how the pandemic is affecting communities of color?
Yeah, thank you, Ricardo. Commissioner Malcolm, I'm going to leave that to you.
Thanks, Governor. It is such an important question, and as I mentioned in my brief comments, we have a pretty significant percent of the cases that we do not know the racial self-identification. This is self-report data, and a lot of people, understandably, have not been too excited about sharing those data with us. But it's important that we get as much specificity in this as we can. We believe that just like with other conditions, we're going to see a bigger burden of illness in some populations than others. We have talked, and I'm sure we'll be talking much more in the future about particular at-risk populations. We've rightly focused on long-term care, other congregate settings like prisons and jails, but also homeless shelters. Both the sheltered and unsheltered homeless populations we know are at significant risk here. And given just the relationship between risks of more severe disease and chronic underlying health conditions, just the fact that we know from our other health disparity data the disproportionate burden of some of those chronic diseases on populations of color, American Indians, and also distributed interesting patterns by geography, age, and so forth. So it's those reasons that make us expect, frankly, that COVID-19 also is going to affect some of those populations more deeply because of their additional health complications that we know that they already have.
Great, thank you.
Your next question comes from the line of Mary Lehammer from PBS. Your line is now open.
Hello, Governor. The question I'd like to have is about extension of the stay-at-home order. It's probably the question I get asked the most. I know you've indicated you're likely to do so, but can you give us a sense of your timing, and if so, how long? Are we looking at weeks, a month? What's your thinking right now in extending that?
Yeah, thank you, Mary, for the question. And to all Minnesotans listening, I know that the unknowns in this make it so frustrating. So we're trying to make sure that we are deliberate in our thinking. I can tell you we've been having a lot of conversations since the stay-at-home order was enacted about ways to look and to tweak it to understand what was working, what should be some changes made. The suggestion that Senator Gazelka made about outdoor activities is certainly one we hear about, and we want to take all those into consideration. So this afternoon at 4:30, for example, I'll be going through a sector-by-sector walkthrough with my team. We're hoping that sometime midweek here we're able to communicate with everyone. I was on this morning with 100 or so of the biggest employers in the state. We'll get with small business owner groups. We'll talk to labor worker groups and try and get it from there. As far as the timing of how long it goes, I think this is the real question. We've kind of taken it, letting the data kind of drive us, see if we could get some changes, see what the stay-at-home order did and where it worked and where it didn't work. And on our website, I think it's up on the website now, but this weekend I got briefed on this by our social distancing folks and our technology people, and now they're starting to compare us with surrounding states and the country to see how good we're doing. In certain areas, we're real good, and I think your listeners wouldn't be surprised about this. We're not so good in social distancing in recreation areas right now. So I want to look at those things, see if there's things that we can tweak and be able to implement that. And I think for us, aligning certainly with some of the federal guidelines that said to the end of April, at least that's a good starting point, but we'll let the data and the science drive us about how long we need to do that. I certainly don't want to set up a false hope that this is going to be, quicker and it's going to be removed. And I also don't want to set this too far out why people get frustrated and say, well, how do you know? A lot can change by May. So we'll try and strike that proper balance. We'll try and have the data and the facts support us. You can rest assured that the input that people are telling us about of saying these industries can function, we can do social distancing, we can police this, we're listening to that because I share that concern too. If it's a landscaper working alone, if it's one person on a lawnmower on a golf course, we need to take that into consideration. So hopefully we'll have you an answer here in the next day or two.
Thank you.
Next question comes from the line of Tim Nelson from Minnesota Public Radio. Your line is now open.
Hi, Governor. I actually got a question for Commissioner Grove, given the discussion we had this morning on the Senate committee about the economy not coming back until the first quarter of 2021. A few weeks ago, the commissioner said Minnesota's $1.5 billion trust fund for unemployment could sustain 12 weeks of surging claims. Can you tell us where that account balance stands, and if you're worried now that eligibility is expanding that this isn't going to go as far as you projected, may not carry us into that recovery up ahead?
Thanks, Tim. Great question. I am not worried for a couple of reasons. One, the federal government's additional assistance they've announced comes from federal government budgets, not from the state's budget. So that extra $600, those extended weeks, that all comes from federal funding. And secondly, the federal government, in instances like this throughout history, provides zero-interest loans to states to extend their unemployment insurance benefits, which are often forgivable. So our trust fund, as I said a few weeks ago, is in healthy shape going into this. Of course, it gets drawn down every day, but every state's facing that same trajectory, and we're working with the federal government to make sure we can keep paying Minnesotans. I don't have an updated modeling number for you today on exactly where the trust fund is, but we'll continue to model that out and share that information when we have it.
Thank you.
Next question comes from Tom Hauser of KSTP TV. Your line is now open.
Thank you, Governor and Commissioners. Speaking of modeling, Governor Walz, after your State of the State address last night, I know on Twitter and social media and my email box, Minnesotans wondering more than ever, what is the data that is driving your decisions right now and your assessment last night about winter is coming and it's going to get darker before it gets better? Are we any closer to getting some transparency in the modeling that you're relying on to make these decisions?
Sure, Tom, and we're using multiple ones. If you know by now, there's a lot of folks that started on this. Minnesota was one of the first where there was nothing out there. And our folks got to work over at the School of Public Health, University of Minnesota, and Commissioner Malcolm's folks put out some of our original numbers. And pretty much like everybody's number shows, if you didn't do anything about this, it was going to be pretty catastrophic. Since that time, we've tried to rely on some of the other ones that are out there. Certainly CDC is modeling. I think our folks are updating what we had, and keeping in mind that this was This was one that was created for Minnesota, for us. But there are multiple things that we're looking at. We're looking at actual folks who are now showing up. That modeling was before very few people had showed up at the hospital. Now we're seeing where they go. I'm asking them to get back to me in I'm thinking today or so I'm going to get an update on some of those numbers, but they're coming from multiple sources. We're trying to push it out as quickly as we can, but I think the folks who sat down with some members of the press made it clear that that modeling was mainly showing trends. The data that populated it was too sparse at the time to draw any definitive conclusions, but I think what we've seen is it drove a model that we've seen globally, that if you can stop spread of this and you can get a containment on the peak, you've got a much better chance. And then we're learning a lot more about this. So you'll see more on this. I think I can say is the data you're hearing coming out from Commissioner Malcolm, the data you're hearing us talk about economics of what's driving are all going into these decisions. So it's not just one model, and we're not just relying on the initial data we used to make it. We're relying on multiple sources.
Is there going to be a time when it's going to be very transparent, where Minnesotans can maybe look up on a website what these numbers are, similar to what the University of Washington does with its model that has shown really a dramatic reduction in potential deaths from COVID-19 in Minnesota?
Yeah, and I would say, though, the first indications on the University of Washington site was off by about 15% in New York City. So even that model had a 15% error rate in the very first site of this. But yes, Jan, I might refer to you because some of this is proprietary information that the researchers over at the University of Minnesota have. And Jan, maybe you can speak to this, because the idea that we would not share information is simply what we have to be very careful. I say we as our team to put it out there, because there is a misinformation machine that will try and put that there is misleading information. Our data is being used to drive decisions to get to an endpoint. Nothing could be further from the truth, but I may let Jan mention of how do we get out there? How do we let somebody get in under the hood to see the model, the original one, even though that's not the only numbers we're depending on now?
Sure. Thanks, Governor. I think the governor explained it about as well as you could. The first model was a version 1.0 that the researchers knew could be improved with more updated factors, learning more about average lengths of stay in the hospital, percentage of people with the disease going into the hospital, all those things. So when it was first built, it was just using international data, which was the best that we knew at the time. So the hesitancy to publicly release the version 1.0 was really much more about it was such a work in progress, and it seemed reasonable for the U to have more time to make some improvements that they knew needed to be made. I think it's absolutely our intention to be as transparent as possible about both the assumptions and the outputs, under that giant caveat that the governor keeps reinforcing, and I do too, that models are just directional and really should not be used by anybody to say on X date Y is going to happen. It's really about getting a macro sense of what levers you have available to you around social distancing, around increasing hospital capacity, and what that does to the model. And to the governor's other point, we now are supplementing the model. We're rerunning the model with newer, better informed inputs, if you will, more Minnesota data. That's just happening as we speak. The governor will get briefed on that real soon. And it is the intention to allow folks to see, kind of under the hood of that, about what were the assumptions. We just are going to keep pleading for judicious use of what the results are. But we also have a lot of other interesting data in addition to the model. Just one quick thing on the University of Washington model, because that people quite understandably ask, why the big variation in those numbers? And the Washington model had some particularly, we would say, optimistic assumptions. First of all, on social distancing, that Washington model assumes a level of stay-at-home social distancing that we just really could not, as a practical matter, expect to see in the United States or in Minnesota. It also only goes out 4 months. Our model goes out a year. So the data just aren't apples to apples in terms of totals that we're looking for. Sorry for the long answer, but we're very appreciative of the importance of making these things transparent, and we will do that.
Thank you both.
Thank you, Commissioner. Yeah, Tom, and Teddy, if we have extra time here, I don't know how long we have the call, but we've taken some extra time. I want to make sure we get in as much questions. So if we run a little long today, if that's possible, let's do that. And Tom, I'd like to note that the Washington, the IMHE model was not even out or complete for Minnesota when we were making decisions. So if people who are listening, looking at that model or others, I would have, in retrospect, made many of the same social distancing moves that we made. So as far as it driving answers, or were we making decisions based on faulty data to end up where we're at? I think the other models confirm that we would have made these same decisions regardless of the severity or the margin of confidence interval that was on their models. So it's a great question. It's one that people are asking. I think, and we'll do this, and I'll ask Jan to do it too, I worry about this one a little bit because this starts to fall into the black side of the internet on conspiracy theories, and I want to make sure we're doing all we can to make sure we're not keeping people in the dark and we're not opening up a space for people to start to put together a scenario that wasn't the case. So we'll do all we can to get that out to you as quickly as possible. Next question, and Teddy, let me know if we can go longer.
Next question comes from the line of Jeremy Olson from the Star Tribune. Your line is open.
Governor, I just wanted to get your comments on your decision regarding the extension of the stay-at-home through this lens. If it's working, why tinker with it? And how will you know when to pull back? I mean, if something's working, maybe you should keep it going because it's working. On the other hand, if you pull it back, I understand the ramifications, but talk through that decision-making process. But if it's working, then why wouldn't you just keep it going?
No, that's a great question, and it is for the most part, not perfectly. I mean, your people always tell me, and I appreciate people who say, hey, I saw a big group together, and again, it's about education. It's not about ratting out someone because of what they're doing. It's making sure that this is keeping us all safe. And you're right, there are certain things that are working, but I do think trying to strike this balance you hear so often, are there things that we could do that would keep it just as safe, would not add to the transmission rate, would not put at-risk populations at risk, and yet would allow some economic activity to continue on? That's, I guess, what I'm trying to strike the balance on. Because, again, I think Commissioner Malcolm brought up a good point, because if I'm not mistaken, they were using, I think Hubei province containment numbers in the University of Washington. Well, we can't, nor do we want to be able to lock down the way that the Chinese lock down, because our society doesn't function that way. So we have to find a little more creative, innovative ways to do that. So I think what we're looking at, and again, the metric I keep telling people is when the transmission rate is low enough that people can get back out, the most at risk are not in danger of not getting the hospital care when they need it, and the mortality rate comes down to a place where we're not seeing that many people, 3% or whatever, be at risk. And those numbers, again, so early in this are hard to come about, but at least what we're seeing here is, I can tell you, not hitting the peak in the hospitals will be the happiest day of my life. So we're going to err on the side of making sure that we don't go over that peak. But I also think we have to be responsive enough to say, yes, if you shut everyone down, there would be less transmission. This would happen, but that also does come with another side of the scale. So we're looking at it. You're right. Many of the things, I think, I'm not speaking out of order here, will be kept in place because they work. I think we've already, indicated that around restaurants, schools. There may be others, but I want to make sure that we're not just giving a blanket statement. We're not listening to people and being adaptable enough. And if there are ways to get some of these things going again, we should try and do that.
Thank you.
Governor, this is Teddy. We can continue keeping questions and run a little over today. Thanks.
Thank you.
Next question comes from the line of Jeff Wagner from WCCO. Your line is now open.
Thanks for having time to let's ask some questions here. We've heard before that health officials have been able to trace these super spreader events to large gatherings across the country, like maybe a specific birthday party or a church service. Has that determination been made in Minnesota? Is there a gathering that has been responsible for a larger number of people being sick besides just a couple people in a household or a congregate care center? Has there been an event where transmission happened where everyone had gathered and went back home?
Commissioner Malcolm and maybe Chris on that one, if you wouldn't mind.
Yeah, I think Chris Erzman is with us as usual as an additional resource. I think we still want to be careful about not getting super specific about specific incidences, but we certainly have seen in a lot of the work of contact tracing attempts to find common links and common causes like that. So I think there have been some church gatherings and perhaps other things, Chris, that you could mention.
Sure. Yes, we have identified a couple of events where not necessarily we haven't identified a super spreader as much as the event included some large groups of individuals in family clusters that allowed for more spread than we might have expected in other situations. So we haven't specifically identified a situation in which we've had a super spreader, that is one individual that was particularly efficient at spreading and transmitting disease. But we have had a couple of situations in which we know that a great deal of transmission occurred, but mainly because it was a group of individuals gathering together who then went on to have the opportunity. Not only did they share it at the gathering, but then when they went back into their households, they had the opportunity to share it within their households.
Thank you.
Next question comes from the line of Theo Keith from Fox 9. Your line is now open.
Governor, I'm wondering what you think of this and if you've heard this criticism as well. I think based on the emails that I get, there's a frustration out there among people that hundreds of thousands of people have now been laid off, thousands of businesses have been forced to close, and you're relying on a model that was preliminary. Understandably, I think everybody understands it's preliminary at the beginning, but now they can't see it. What do you say to people with that criticism, with that concern?
We would have made the same decisions anyway. It's where the rest of the country's come to. It's where even the Trump administration has ended up. We were asking for something that hadn't been created yet. I think we've explained it, and I'll continue to push on this, because I certainly don't want this idea that, they used false data to get to a place where they wanted to, they could do this. Trust me, no one wants to run a deficit as governor, and no one wants 10 to 12% or 15% unemployment. So there's no joy in this. There's heartache and pain, and these are terrible decisions. I used the best data available. Again, there was no IMHE model when we were doing this, and I think getting on the front end of it, we have avoided what could have been and what appears to be in certain parts of the world catastrophic. So I would tell them that we will do our best. I will ask, and I will continue to push the folks who modeled this. It was 1.0. It was a brand new pandemic for a brand new disease with an R0 that was relatively unknown based on data coming in globally. And it was constructed using minimal amount of Minnesota data to give me a picture on, if I don't change anything or I don't take some actions here, what's going to happen. That was one piece. I could turn on my TV and see the destruction in Italy, see the destruction in China. I didn't need a model to tell me something needed to be done differently, and in every place it was mitigations. So I will look back, and I will certainly be the first to tell you, are there decisions that I should have made differently? Certainly in any case, when the story of this pandemic is written, that will be done. But nothing was going to change my assumptions that I needed to err on the side of protecting as many Minnesotans as possible using the best available data. And what I am pushing on is and maybe it's impossible in today's world, to stop conspiracy theories before they get going. So I will keep asking, try and get them out the numbers that went into that. Folks can see the R0 and how we were figuring it based on that available data at that point in time in the middle of March. And as I keep saying in these briefings, the world will be totally different by next week when we brief. And so that would be my answer to those folks. I would say that they're right to be able to ask to see some of this. I want to try and get as much as I can out. but I would tell them in the totality of all the evidence we had and the decisions making we made, this wouldn't have changed very little. I would argue what it did was it let Minnesota move in a pretty deliberate and quick manner that appears to be, and again, I think it's way too early to assume that it's worked as well as it should, but appears to be moving in the right direction.
Thank you, Governor.
Next question comes from the line of Nora Herschel from St. Cloud Times. Your line is now open.
Thank you so much. You all have mentioned a little bit about the projection from the Institute for Health Metrics and Evaluation from the University of Washington. They are suggesting now that there won't be a shortage of beds in the state of Minnesota. I'm wondering if you could talk about those preparations. And I know Joe Kelly mentioned the medical sheltering plan. So I guess if you could address both of those, how we're looking in terms of bed and hospital prep.
Yeah, I'll let Joe and Jan figure in. And once again, every model, no matter it's University of Washington, if it's Crown College, whatever, or if it's the model put together here in Minnesota, there's going to be a spectrum of spread, plus or minus on each side of it. I can't afford to be too short, and I can't afford to be too late. And trying to strike that balance, I still think that we've got work to do. I am still not comfortable that we have all of the ICU beds, all of the ventilators, and all the personal protective equipment that will come. I worry a little bit. Again, we want to get the most accurate modeling, but those that want to lean towards overly optimistic modeling could be making the same mistakes in the criticism about leaning towards overly pessimistic models. The only problem is an overly pessimistic model, yes, we'll end up with more hospital beds than we might need it. That is a much better scenario than ending up with too few. So I'll let Joe and Jan maybe fill in any details there.
Joe, you can go ahead first if you like.
Yes, thank you, Commissioner. I'll talk about the alternate care sites. And again, for a reminder for everyone, those are those temporary auxiliary facilities off of the hospital grounds, if you will, for a visualization. I'll let Commissioner Malcolm talk about what our hospitals are doing to surge their internal capacity. That team that I've talked about over the past week or so has been very busy. They evaluated, 27 sites, and as they've added all those up, they've come up with more than 2,700 possible beds, and they're still out there looking. So the good news is, especially in the places that are former nursing homes and even some old hospitals, it appears there's a good stock out there that will be reasonable for us to stand up. That alternate care site plan is extremely scalable. When and where and how many, depending on how the hospitals are able to handle the capacity with what they normally have and what they are surging to accomplish. So I'm going to recommend that we execute, if you will, the plan to stand some of those sites up just so we learn how to do it, and so that we have some initial overflow capability, and then we'll develop some metrics and some predictive way of knowing when and where and how big we need to set up around the state. But because that all ties back to the capacity that the hospitals have, I'm going to turn it back to Commissioner Malcolm, who might have some information about how they're doing in their current facilities.
Thanks, Joe. Yep. So we've talked, I think, a little bit before about the fact that the hospitals are doing really incredible work collaboratively. They're talking together. They're not just planning one hospital or one system at a time, but really looking at the combined picture. And they're identifying beds that could be converted from kind of regular use, medical surgical use, to ICU use, and even other parts of their physical facilities that could be like a physical therapy gym, for example, that additional beds could be added to as that surge approaches. And I would tell you the health system leadership in the state, as well as the public health folks, still believe there's going to be a surge and still believe we're going to have some real challenges, particularly with the limitations on equipment and personal protective equipment that the governor has talked often about, just the challenges globally of the supply chain with every place on earth needing the same stuff all at the same time. So that continues to be a real challenge for us on not just the physical plant side or the ability to repurpose beds, which the hospitals have kind of got their eyes on how much of that could they do within 24 hours or 48 hours or 72 hours. And then what would be the contingency plans after that in some of these alternative care sites, as Joe was explaining. But and I think some of that high-level data is linked to the governor's dashboard. And I think we're fully intending for people to be able to understand, kind of what is in that pipeline and what kind of progress are we making toward closing any capacity gap there might be. But just to reinforce the governor's key point there, we'd rather plan for a higher level of need. We sure don't want to be underestimating what that need is. So, and we're talking literally daily with all of the health systems all over the state just to make sure we've got real-time data from them. It's just an unprecedented level of information sharing and collaboration. I think it's different than what the governor and I are both hearing from our colleagues around the country, and it will, I think, serve us really well.
Okay, thank you so much.
Next question comes from the line of Paul Scott from Forum News Service. Your line is now open.
Hi, I think this might be for Commissioner Malcolm. Mayo Clinic released its serology test today. They're going to be manufacturing a smaller number, but they are going to get up in higher volume, possibly in a month. Has the health department started making plans for a sero survey to get an idea of how many people might have already gotten this and developed antibodies?
Yes, we are. The governor has spoken about some of the work groups that he has tasked with taking advantage of this lead time that the social distancing has bought us to slow down the rate of growth of cases in order to build up some very specific plans. We just talked about the hospital surge capacity, the whole work stream that you've heard from Commissioner Roberts Davis about the difficult work of procuring the supplies that we need, but the all hands on deck approach that she's taking to that. Another of those work streams is what is the sort of the testing strategy of the future. Not only how do we maximize the current diagnostic tests we have, but also the serology tests that you mentioned. So short answer to that is yes. We have a work group in place that coordinates with all of the laboratory directors and all the major health systems with the health department to look at how we can build out that testing strategy for the future.
Thank you.
Next question comes from the line of Darren Svensson from Cato Radio. Your line is now open.
Thank you, Governor. We've heard a lot more conversation on today's call regarding the economic impact of this situation. When discussing and trying to set public policy moving forward, how often are the ramification from a health and a societal standpoint, such as anxiety, depression, suicide, domestic violence, that are all associated with a major economic downturn? How big of a part of the conversation is that as you're trying to set public policy moving forward?
Yeah, thanks, Darren. Good question. A lot. We understand that for every action, there's another action, and what we're very careful about is unintended consequences, and trying to weigh those things out. And again, trying to decide on things about human life are obviously the most difficult decisions we make. We don't want to put people in those positions, so we are tracking. Certainly, and we mentioned this early on, we're tracking calls to domestic violence. We're looking at our Child Protective Service numbers every day. We are looking at those numbers of suicide, and again, causation or correlation are things that aren't always easy to prove, but we're certainly watching them. And then the economic side of this is, again, it's not a false choice. We have got to stop this thing. We have to slow it down, because not only had we not done anything would it have been a catastrophic public health problem, it would have also had the same devastating economic effects on its own. So those are a major part of what we do every day. They're part of the conversation. They're part of thinking about it with human health, with making sure that the public health priorities are there, but understanding that these all have other consequences that come with them. So it's a big part of the decision making.
Operator, we have time for just one more question today.
And your last question comes from the line of Sue Kraft from Manhome and Pioneer. Your line is now open.
Hello. Happy birthday, Governor Walz.
Thank you very much.
My question, sir, is regarding playgrounds and parks. I'm working on a story right now regarding certain entities shutting down their playgrounds and parks. The weather's getting warmer, and the parents want to bring the kids out, and the teenagers would like to go out, but we know that could cause great problems, and there isn't a clear message being received from the local entities. Some are shutting them down, some are not, and then there's still evidence. Like one public official told me that there was evidence of teenagers congregating at shelters and gazebos and that type of thing, and so perhaps we need a clear message regarding that matter.
Yeah, no, thank you for it. And it's one of the things as we think about the stay-at-home order, and I've said many times that there has to be a buy-in from the public to understand that they're saving lives, they're making a difference. Trying to convey this message that even if you are showing disregard for your own personal health, you are impacting others, and especially those who are most at risk. So I think the issue on parks and recreation is one we spend a lot of time on. Minnesotans rank consistently top 1 or 2 healthiest states. It's one of the things is we also get outdoors more than almost any other state. So it's what we love to do. And in any other given time, that is a super good public health and mental health measure. Right now, it poses some problems. So I think those are things that we're starting to try and get some clarification. I do know that it helps sometimes if the state is able to give the clear delineations and then you don't have a patchwork of decisions. But we also recognize that sometimes that blanket coverage doesn't take certain things into consideration. So we're hearing you on this. I think probably the number one thing that we get is people congregating too closely in outdoor activities. And it's one that we hope that in this next stay-at-home order or this next mitigation order that we put out deals with that in a little more clarity. But again, as finishing this up and closing out on this question, this just takes all of us in it together, and we have to believe that the data's out there about this disease. I think there's going to be some healthy discussion, and there'll be decades of books written on this before the next pandemic comes. Hopefully we learn lessons from it. But as we move along, we're just trying to make the best decisions that we possibly can. So I'm grateful for all of you today. I'm sorry we ran a little long. The answers were, I think, needed. We need to continue to share as much information as we can. And I've ended these by being incredibly thankful. And my story comes from up in Ely today, up at Wintergreen. Many of you are familiar with the outdoor clothing manufacturer. Sue Shirkey, the owner up there, and all the crew has shut down their industrial side, and they're now using all their equipment to make face masks, medical gowns, headgear for clinics across the Iron Range and the North Shore. And she said the initiative reminded her of stories that her 96-year-old mother would talk about World War II, kind of the Rosie the Riveter posters and the things about working together. So I asked last night, and I always close the state of the state, and I said the state of the state is strong, resilient, and united. Wintergreen and the folks up on the range are certainly making that true. So thank you all, and we'll join you again tomorrow.
Find more local news stories at ccxmedia.org and follow us on social media.